returning to Singapore News, calls for help ahead of a proposed health information bill. Some doctors say they need more tech support, funding and guidance as Singapore looks to make it mandatory for all healthcare providers to share patient information on a centralised health record system. But there are uphill challenges, as Sherlyn Seah finds out, especially for smaller clinics.
So we have to add a diagnosis. Patient has got a common cold. So we have to look for the diagnosis. And we add the diagnosis. So this is input into the system. And we confirm it and we save it.
This is how keying in patient data onto a clinic's digital platform looks like, which then syncs to the National Electronic Health Record System. It'll go towards a comprehensive record of each patient's medical history, so that any future treatment can be given more effectively. But for small, single-run clinics like Tra Medical, which typically rely on the quick jotting down of a patient's condition via pen and paper, they have to play catch-up. And even uploading existing digital data onto the NEHR may require what's called mapping work due to differences in systems.
So the challenge is to link up the 500 drug codes to the current system that we're using. And we have to key in the vital signs of the patient, and also the height and weight for each visit. So there's a lot of more time for us. Many of us doctors find it tough to find time to do all this mapping work when we should be actually spending more time doing doctoring.
Dr. Tra's also hoping for more targeted support to ensure that such electronic information is collected and stored properly.
A lot more funding from the MOH to help us train our staff so that we are more familiar with the keying in of the drugs and as well as keying in the diagnosis.
The Health Ministry has said that only key health information like these will need to be contributed to the NEHR. Meanwhile, some sensitive details that could lead to stigma, for example, will be restricted. To address such confidentiality issues, ethics guidelines are now being drawn up. These will outline how doctors should use the health records and under what circumstances.
For example, I think many doctors are concerned that they will need to access the medical records in every single patient encounter, and I understand that this is not true. It is we only access information when it is required for patient care. The other consideration is, are they responsible for the records that are already present in the NHI if they come across errors and so on, how to handle these situations. I think these will be addressed by the guidelines in specific scenarios.
Such information sharing is also meant to go in hand with Singapore's preventive care strategy, Healthier SG. The bill will be tabled in the first half of this year to be open for debate in Parliament.